Alright guys, so here we're going to talk about the pharmacokinetics, alright? So before we go there and talk about the, pharmacokinetics, let's quickly review what we have discussed so far. So we have talked about, in our previous video, we talked about that pharmacology has the subdivisions, and that one is called pharmacodynamics, and another one is called pharmacokinetics, right? And kinetics, as we said, that kinetics means what? It's called movement, right? Movement of the drugs. And that has been determined by your body. So basically, what body is gonna do to that drugs? That's what pharmacokinetics basically means. And then in the next video, we'll talk about the pharmacodynamics. Dynamics always think about actions. What your drugs is gonna do to our body, all right? And in the previous video, we also talked about the nomenclatures of the drugs, all right? Different names of the drugs, like generic names, or we also talked about brand names, or also the chemical names, all right? And we also discussed about the route of administrations. What are the ways that, drugs can be administered to our body, right? So we talked about all of that. And here, as we said, we're going to talk about when you administer your drug, how your body is going to react to the drugs. Okay, what is the role that your body is doing to help to move around that drugs? That's what we'll be talking about here. So whenever we talk about this pharmacokinetics, there are a couple of things. What we talk about. First thing we talk about is the liberation. All right, we'll talk about this. What is liberation? We'll talk about it. All right. And other thing is that, what we talk about, all right, you took the drug, it's going to get liberated, and after that it has to get absorbed too, right? And then after that, what we talk about, when you get absorbed, what we talk about, now it's going to get distributed. It needs to get distribution to its target organ, all right? And then after that, look, it should get metabolized or biotransformation, because remember, we can't keep having drugs accumulate in our body, right? Somehow it has to go out of our systems. And the fifth, we always have to talk about eliminations or excretions, right? Whatever you like to call. So these are so whenever we talk about pharmacokinetics, these are the five, main, let's say subdivisions that we need to have a very, very clear understanding of it, right? So whenever we talk about the liberations, what is liberations? That's what we talk about first, definitions, right? Liberation basically means is that, whenever the drugs comes, they all comes in a different properties. They have a different chemical properties there, right? Because some drugs are released in a very, very slower pace, and some drugs, work much more better in an acidic environment, and some drugs work better in a basic environment. All right, so it is the property of that, the structure, the property of the drugs will determine that. And also other thing is that the route of the administrations, how does you're giving that drug? Are you giving the drugs orally? Are you giving intravenously? Are you giving intramuscularly? That also plays a role. All right, so that is what liberation basically means, right? How does a drug, all right, releasing, all right, and then once a drug is releasing, meaning it's getting liberating, all right, liberating, and then after that, it is going to get to the next phase, which is called absorption phase, all right? So, for this one, I like to quickly draw a diagram for you guys, all right? So let's make a diagram right here. Let's just make this as let's say this is a time, all right? And let's say this is going to be the plasma concentrations of the drugs, all right? Or you could even simply say, sometimes, the drugs, you can simply, sometimes you can say, whenever you hear concentration, you can think about drugs, basically, All right, so usually, let's say, 0 is going to be here. As we discussed before that, whenever you give intravenously, what happens? It directly goes to your vascular compartment, right? or it directly goes, because it directly goes to your vascular compartment, which means that it passes as first pass effect, which basically means that it does not get metabolized, right? So because of that, what happens? You're going to have something called 100% bioavailability like this. And the graph looks something like this. All right, because this shows that this is a distribution phase, and then it goes, and then as it's coming down, as the time comes, like let's say, okay, this is 0 time here, 1, 2, 3, 4, let's say 6, right? So basically, as the time passes, right, what is going to happen is that, these drugs will eliminate from our systems, right? So this is like distribution phase, and you can simply say this is elimination phase, all right? But this is for like IV, let's say this is we can say this is my IV drugs, all right? It could be any drug. You're giving intravenously, right, to the veins. And let's say, if I want to give intramuscularly, look, what is going to happen is that when you give intramuscularly, it is not going to have as fast onset of action comparing to the intravenous. It is going to have a moderate amount. So because you're giving intramuscularly, what is going to happen is it is going to get slowly, it's going to go up, and it's going to absorb, okay, it's going to absorb, and then it's going to come down like this. This graph should look like intramuscularly. But then if you give, let's say, subcutaneously, then it's going to even have a slower, onset of action, let's just say. And it's going to look like this, because this graph is basically showing is that, it's something like this. And then and by the way, when you reach this one, this basically means it reaches its maximum concentrations, okay? That's what it means. And then it's going to come down like this. Okay, so this is referred as subcutaneous, all right? And then after that, we also have to talk about, okay, now you give intravenously, you give intramuscular, subcutaneously. But what about if you take orally? Because orally has a very, very slow of what? It's slow of absorption. Remember, when you have headaches, when you take when you have a headache, when you take like baby aspirins or let's say Tylenol, it takes a certain time. Your fever doesn't go away like within like 10 minutes, right? It takes time. So that means the absorption time for this one is lower for especially orally. So we'll make this let's say red here. All right, so we'll make it in oral. So this looks something like, and this will be oral right here. All right, so basically this going up right here. This is telling you about the absorption state. Like this is basically, all right. Then after that, what is going to happen? This phase right here is coming down here. This is called elimination phase. All right. So this is diagrammatically you can look at this graph. All right. Now after this, all right. So this is for me to define, for me to describe what liberation basically means, right? That's why I drew this graph, right? And now, after that, let's go and talk about what absorption basically means. Whenever we talk about absorptions, like this, I said absorbed, but whenever we talk about absorptions, we have to talk about how does the drugs get absorbed. And remember, all the drugs that get absorbed where? In your vascular compartment. You need to remember that. It is a vascular compartment. All the drugs, all right, it needs to get absorbed in the vascular compartment, because from there, it is going to go to different part of the, it's different part of the cells or organs, right? Because this is going to be, this in the blood here, this is where, absorption needs to take place. In order to get, because from blood, that's how it's going to travel around to the other parts of your tissues, all right? So absorption, whenever you think about the vascular compartment, all right? That's what you have to think about here. Now, after this, what do we talk about? But then in order to have the absorptions, there are a lot of things we need to talk about. How does the drug is getting to the vascular compartment? Look, whenever it has to pass us to what? It has to pass us to what? Cells, right? We're made out of cells, trillions of cells. So it has to pass through this plasma membrane. That's the focus here, right? So first is that the drug, whatever we take, they have to pass through this plasma membrane, all right? And we need to understand that in a very detail, all right? So if you look at this, you see right here? If you see right here, I drew this as you can think hydrophilic, and this is the fatty chains, right? This is hydrophobic chains, which basically means water hating. Hydro means what? Water. Phobic means not loving. Hydrophilic means phil means love. Hydro means water, so water loving. So this is like water loving, this end right here, right? And you guys know this. The phospholipids are the bilayer, right? So what happens is that in order for drugs to get into it, there are multiple ways that drugs can get in our systems. Let's write down a couple of those. What are those? How does a drug get into our system? Let's say first we'll write it down here. The way drugs can get in your system is one is called, let's say, passive diffusions. All right, it's called passive diffusions. It's very, very important, right? Because it doesn't require any energy. Other one is, okay, it's called fasciculated diffusion. All right, we're talking about this one, guys. How does the absorption take place? Because this is how it's going to get into the vascular compartment, right? Third, it has to be active transport. All right? Or four, endocytosis or exocytosis too, all right? So basically, these are the way, okay, drugs uses, these are mechanisms of how drugs can actually get into, get into your plasma, basically, let's say, in your vascular compartment. Whenever we talk about the passive diffusions, passive diffusion is basically is that, okay, they're not using any energy at all, right? What is happening here is that they can easily diffuse through this plasma membrane, all right? So if any, do you know any drugs that can easily passively diffuse through? Remember, the cells have this plasma membrane, and this portion right here I draw, this is hydrophobic, right? Meaning water hating. They do not like water. So that means they do not like any water-soluble drugs. That means that, okay, for the passive diffusions, all right, what needs to happen there is that they love fat-soluble drugs or lipid-soluble drugs. They can easily pass through the plasma membrane to get into the vascular compartment or to get into the cells. That's what these guys do. Basically, so this drug, the passive diffusions, all right, so they can easily come down from here. Let's talk about here. Easily pass through this, all right? Any sort of like a fat-soluble drugs or lipid-soluble drugs. That's the reason why a lot of the drugs are designed to be lipid-soluble drugs, because they can easily pass through this plasma membrane, lipid-soluble drugs. They can even pass as a blood-brain barrier, all right? They can easily pass as that. So because of that, this is very, very important for lipid-soluble drugs, all right? But, okay, we got the fact that lipid-soluble drugs can pass it there, all right? But then what about the water-soluble drugs, all right? Can water-soluble drugs can pass it through here? Those are polar compound, right? And water-soluble actually would not able to pass through here, but then what happens is that, we have in the plasma membrane down here, we have the channels for those drug to pass. Because in between the cells, let's just make this as one cell here, and there's another cell here, look, another one cell, two cell here, right? Basically, in between these two cells, all right, there's this channel, all right? These are water channels, or so because of that, from there, we call them intracellular cleft. From here, those water-soluble drugs, let's say, water-soluble drugs can pass through this. Look, even because there's a channels for this to pass through this drug, let's say make this a drugs right here, it can pass through. Still though, it did not use any sort of energy. So we still call them a passive diffusions. But then if you want to be very, very specifically, then you can call them, what do you call it? You can call them aqueous diffusion. Aqueous, let's write down here. This is called, let's say, we can divide this aqueous diffusion, you can say this is a lipid diffusion right here. Lipid diffusions right here. And you can say aqueous. And if you want to remember aqueous, agua in Spanish, that means water, right? So basically these are the diffusions of this, the water-soluble drugs, all right? So basically, this is one way that these water-soluble drugs can actually pass us, and that's how it can get absorbed, all right? Now, but remember, these both are passive diffusions, all right? Now that we were talking about what is this facilitated diffusions. Facilitated diffusions, which basically means is that it uses the carrier protein. It basically is a carrier protein for it to, like, you know, to help certain drugs or hormones to actually pass through this. Like, for example, if you were thinking of, you know, this facilitated diffusion, think about insulin. You know what insulin does? Insulin goes and binds with this like tyrosine kinase receptors. Remember, in the skeletal muscle or muscle cells, and what they do? And it sort of like puts, like, you know, this GLUT4 transporter into the membrane so that our glucose can, we can just take glucose inside the cells. That's what facilitated diffusion basically means. All right, that's the easier way. So basically, even though, like, you know, it is using the carrier transport to actually basically, like, you know, pass through, like putting a channel here, you're bringing the drugs inside the cell. That's what this facilitated diffusion do. But there are certain drugs, all right? You know, you cannot pass through. You know, it cannot. They're big. They're bigger compounds. They're bigger molecules. They cannot pass through this. They're not lipid soluble drugs. They're also not water solubles, or maybe they're bigger in molecular weight, so they cannot pass through this, okay? Because there has to be a certain size in order to pass through this. So if you cannot pass this, sometimes there are, like, you know, we use active transfer. What active transfer basically means is that you're going what? Against the concentration gradients. Remember, the passive diffusion is always about the passive diffusion. Whenever you talk about passive diffusion, always think about what? Always thinking about, like, you know, you're going for either like high to low concentration. That's what basically it means. And that is also, like, you know, this diffusion, this pack is also explained by someone called Fick's law. Let's write down what is Fick's law. Fick's law, which basically says that, all right, in order to diffuse the cell membrane, what do you need to careful about it is surface area, right? And then you have to know your molecular weight, your solubility, whether they're lipid soluble, water soluble, right? Solubility. Remember this equation, guys. It's very, and then it's square root of molecular weight, because remember, if it's a molecular weight, like, you know, the larger proteins have that, you know, proteins have a larger molecular weight, you know, so they cannot pass through this. And also the concentration gradients, like, you know, C2 minus C1, basically, and over the thickness. Because if this guy is very, very thick, it would not able to pass through it, all right? So it is really important if you have a large surface area, and then solubility, if it's a lipid soluble drugs, and also the concentration gradients are higher. Like, for example, if you want to give a drug, okay, what is going to happen is that if you keep increasing the dose, which means that the concentration is going to go up, and even they're lipid soluble, and then they have increased surface area, then what's going to happen? They can diffuse in a much more faster rate, all right? The rate of the diffusion will be very, very fast, all right? So basically that's what this Fick's law tells you, all right? And that can explain your passive diffusions, all right? Both with the aqueous diffusions and also with the lipid diffusion. And then we talked about facile diffusions. And this active transport is where they require energy. Basically means is that, you know, whatever channels is there, right? They directly use ATP in order to move against its concentration gradients, because what is happening here is that the drugs is not able to move through, all right? So in order for the drugs to, like, you know, move, like, you know, you need to use, like, you need to use that against concentration gradients. Like, for example, any drugs that can, like, inhibit, we can simply say, like, sodium potassium channel, right? But what is that doing? Because sodium is using directly to bring three sodiums out and bring 2 potassium out, right? What is that happening? Because it is moving against the concentration gradients, right? So basically, that is one of the examples of using an active transport, all right? Now, that is after that, we also have to talk about endocytosis. And endocytosis basically means is that when sometimes, like, you know, the molecular weight of the drugs is really large. Like, for instance, for like a folic acid, or even like vitamin D's, like 1,25, you know, the hydroxycholecalciferol, right? That's a vitamin D, right? What happens is that because of their larger molecular weight, what happens is that they cannot pass through this, okay? And they're not lipid soluble, all right? And they don't have a carrier protein to transport those, so we cannot use past the diffusions. They cannot go to past the diffusions, and then because they're so large the molecule, they cannot even use energy to actually move into the cells. So what happens is that they use something called endocytosis, which means that they will create something called clathrin coat, and then they'll make this the vesicles, and they will sort of engulf inside it. That's what this endocytosis basically means. And these are usually for a bigger molecular weight drugs. Like for instance, as I said, one would be like vitamin D or even folic acid, right? So this is how drugs can get through to the cells through this process, right? So these are the different ways the drug can get absorbed, all right? Now, after that, we also discuss Fick's law. But after we also have to talk about, there are a couple of factors that can, that we have to consider whenever we're talking about the absorptive state. And that is, bigger concept here, the drug itself, the property of the drug itself. Either drug is ionized drugs or it is not ionized drugs. And what does that mean? We have to talk about it, because we have to talk about the chemical properties of the drugs, whether it's a acid drugs or it's a base drug, whether it's a weak acid drug or weak base drug, because that is also going to determine your absorbed, whether it's absorptive state, and that is also going to alter the, where it's going to get absorbed more or better, what part of the area, or where it's not going to absorb efficiently, okay? And that has to do with these ionizations of the drugs, whether it's ionized or not ionized, and that's what we talk about here, all right? So, after this simple concept, let's talk about this. You see this graph here? It's very important here. Usually, if you guys remember, from back in high school, we write something called if you guys remember this HA right here. What is this? It's basically, in a simpler term, we write this HA, right? You have this proton attached with this compound, all right? And the molecules. And then what is going to happen is that if I disintegrate this, or if I disassociate, let's say this disassociates, whenever I deassociate with this compound, okay, because there is with this molecule, a molecule, it could be anything, okay? It could be anything. So let's say, or I could even say the aspirin, right? So let's say this is a weak acid, okay? And if it's a weak acid, that means that it has a proton attached to it. I mean, this H is proton, right? This compound, but it doesn't have a charge. So what do we call them? We call them a non-ionized. Okay? It's a non-ionized because it's non-ionized, and or you can simply say this is a lipid soluble drugs, because if it's a non-ionized drugs and if it's a lipid soluble, that means it can easily cross what? It can easily cross plasma membrane, as we discussed about before, because your water soluble drugs, that cannot cross blood-brain barrier, that cannot cross plasma membrane, all right? So it is important to know that, all right? And another thing is that when it disassociates, right? Or we can say deprotonated, that's what they say. Deprotonated basically means, remember, you're removing the proton group. Here, this one is protonated form, all right? Because protonated means, think about protonated, which basically means proton is attached to this molecule, all right? When I get disassociated or deprotonated happening here, D with protonated, this get disassociates or deprotonated and become H plus, all right, plus A minus. Think of it this way. When this compound, this weak acid, when it disassociates or deprotonates, what is happening? It releases acid and it releases its molecule. That's what it did. And when it releases, what is happening? It gains these charged particles. So this is what, when it gains charged particles, it becomes polar, right? It becomes polar, and this is what we call the ionized compound. ionized compound. Or you can say water soluble, you can say. Or this is a deprotonated form of the drug, all right, this A, and it releases acid there, all right. Now, what happens is that, if you increase the concentrations of acid, right, what is going to happen? If you increase the concentration, because right now this is going this direction. If you increase the concentration of acid, what is going to happen is this will start going this directions, and you start making more non-ionized, okay, or unionized. If you increase the concentrations of acid, I want you guys to remember this really carefully, okay, because this is a very important concept here. If you increase the concentration of proton, because this arrow is also an equilibrium, okay, and sometimes we refer to this as a K1 or K2. Later, this is what's going to determine something called pKa, all right, and we'll talk about what that means too. So, this ionized compound or water soluble compound, when the drugs are in this form, this can be easily cleared from your system, okay. So these are better clear drugs whenever they're water soluble drugs. You can eliminate them, all right. But this water soluble drug, they cannot cross blood-brain barrier, all right. They cannot cross the plasma membrane efficiently, all right. But they are better cleared, all right. Now, and this H plus is the one that's going to determine your pH, right? Because remember, it's and whenever we talk about pH, we're talking about logs. We're talking the negative log of the proton concentrations, all right? That's what tells us about, pH, right? So whenever you take that, whenever this proton level keeps going up, right? And you took the negative log of that, what is going to happen? The pH is going to be like 3.4, 3.5, right? And that's what your pH is, right? When we take the negative log of the increased concentration of pH, that's going to determine that. Now, after this, let me quickly talk about, this is for the weak acid, right? Like, for example, what are the weak acid? One is your aspirin, right? Very common, like aspirin is very, very important. Like, let me just give you an example of this aspirin, like weak acid, right? And then, let's talk about base, like this is acid, and let's talk about base here. With the base, usually we write down B here. Okay, let's use a different color. Okay, B. All right, with the B, right, and then H, like this. Whenever these are BH, right, whenever in the BH, that means this is BH plus right here. Because it has an electron charge and this is a base, we say this is a ionized. Because it has gained charge. Or it's ionized, also it is a water soluble, and also it is a deprotonated form. Alright? Now, after what is going to happen here is that, look, let's say if this gets protonated, right? If this gets protonated, what is going to happen? You're going to have H here, and then this is going to lose the charges. So like if you see this compound right here, this is what is called unprotonated form. Like this is let's say non-ionized here. Alright, there's a non-ionized, alright, or this is like also protonated. Alright, and other thing here is that these guys can pass the plasma membrane easily. Whenever you see a charged molecule, alright, whenever you see a charged molecule, basically what that tells you about is that they would not able to, cross the plasma membrane. So this is a non-ionized here, and this is protonated, or you can even say this is a lipid soluble. And this is for weak bases, right? For example, PCP would be one. Like amphetamines also would be one. Alright? So these are examples of this. And importance of this is, what is the importance of this is that, knowing this, okay, it can help us to determine where the drugs will get absorbed better. All right, knowing the ionizations, whether they're ionized or not ionized, that tells you what drugs you should give, so that way it has a better effect. Like for instance, let's take examples of aspirin. All right, you know what we said about this aspirin. When you take the aspirin, let's say aspirin is given here. If you take orally aspirin right here, what is going to happen here is that aspirin is going to come down here. All right, and when the aspirin comes down here, look, the pH of the stomach is what? It's like 1.5 to like 3.5, right? It's very acidic in stomach. The small intestine, like right here, the pH is about like 6.5 to like, let's say 7.4. Here the pH is from, we can simply say this is like 1.5 to like 3.5. It's very acidic in stomach comparing to the small intestine. So if you give aspirin, all right, what is going to happen? As the aspirin comes in here, there's going to be higher concentrations of what? Acid here, like protons here, right? Whenever there's a higher concentration of protein, what is going to happen is that, look, these guys, the proton concentrations will go up, and that's going to drive this reaction to this opposite direction, meaning that they'll make more this non-ionized compound, or let's say they'll make more of this lipid-soluble compounds. Non-ionized, lipid-soluble, proton-naked basically means the same thing, because remember, if the reaction is going this direction, you're going to attach more proton to that molecule. So when that happens, that will easily close the plasma membrane. Easily close up, and that's going to cause like, a lot of other problems. It can give a lot of like side effects, other problems it can give. All right. So basically, what I'm trying to say is that, acidic drugs can work if you give like higher amount of drugs that can create more problems, right? So basically what I'm trying to say, acidic drugs works better in the acidic environment. That's what I'm trying to say. Acidic drug works better in the acidic environment because they will convert into the non-ionized form, and non-ionized form is the one that can easily pass through the plasma membrane, right? But let's say, if you give aspirin, and then whatever, like the plasma membrane is this, like here it's lower, right? 6.5 to 7.4 in the small intestine. When it comes here, what is going to happen? That might drive the reaction other way around. Or it, like for example, if you give drugs like that, it might drive the other directions and you'll make maybe deprotonated form. So like here in the small intestine, aspirin is, we can simply say that aspirin is less absorbed in the small intestine comparing to what is this? In stomach. That is what we can actually determine based on this equations. And this is very, very important concept, guys. And same thing with the base here. Whenever there's a basic environment, right? What is going to happen is that, let's say if you give a basic drug, like let's say PCP or amphetamines, what happens with the drugs is that, they will become more non-ionized. The basic drugs will work on the basic environment more efficiently, and they'll become more non-ionized with this reaction right here, or they'll become more lipid-soluble, and that's how, they will cross the plasma membrane, and it will have their effect. All right. So the key concept, just remember this: acidic drugs, the weak acid drugs, they work better efficiently in the acidic environment. That's the reason why it's really important to know the pH level of the different parts of the organ, like especially know about like stomach and small intestines, right? And then weak areas, the weak basis works best in the pH that's more alkaline, right? That's what I wanted to quickly talk about here. Look, what is this graph telling you guys? You said this pH minus pKa. All right, and there's this arrow here, which basically means is that, look, if you go from 0, 1 to 3, this part right here, 0, 1, negative 1, this is basically telling you about the acidic environment. So look, when the pH, okay, when it's less than, let's say pKa, you're thinking about the acidic environment. This is my acidic environment. Like this is going to be my acidic environment here. So we can say HA is here, right, weak acid. But if you this compound here, your pH is 0 here, that means what? So it means the pH is greater than pKa. We're talking about this one right here. means this is going to be what? Like base, weak base, right? So if you look at this weak base and then look at the pH right here. Look at the pH. Whenever the pH is 0, that means it's heading in this one, right? Which means, look, it's heading this point. These two graphs, the weak base and weak acid, are coming together and mixing here. Okay, this point. So, what is the importance of this is that, let's say, like, okay, just follow me here, guys. Let me erase and let me write down here for you guys. Let's just quickly talk about. Let's talk about this graph here, right? We say pH, right? pH is equal to what? Usually pH is equal to, let's remember, okay, pKa, all right? And then they do, so if I have to talk about this acid, we usually do the product, which is, let's say, A minus over, all right? Over, what is this? HA. Or, what is this? Ionized versus this is not ionized, all right? And then you subtract this, all right, pH minus pKa, and you take the log of that, log, and log are usually exponentially, right? A minus HA, that's what you do, all right? Basically, that's what you do. And then look, this pH and pK, let's say my pH is like, for example, I'm just giving numbers. Let's say my pH is like 7.0. And my pKa is also 7.0, and usually in the exams, you know, they should able to give you pKa, all right? Especially in the step 1 exam. And then, that's what I've at least read. And then you take the log of that, right? The log of, let's say, A minus over HA. Whenever you do this, right? What is 7.0 minus 7? Is 0. Which means that, okay, which means that, and then you take the log of 0, that is going to be 0, right? So basically, when you see that, HA over HA, and then you take the log of 0, which is 10 over 0, is going to be 0 over HA. So that means that A over HA 0 means that we're heading here, down here. That means the 50% of drugs has been ionized, and the 50% of drugs has been not ionized. Meaning the 50% drug is protonated, the 50% drug is not protonated or deprotonated, or 50% drug is lipid soluble, 50% drug is water soluble. That's what basically this geo is telling you, all right? Now, if I say, instead of giving you instead of let's say pH here, my pH is going to be some other way. Let me just write it quickly down here. Now this is an important concept here. If I say like, okay, pH is some numbers I'm giving, okay, let's say it's 5. And then my pKa is, let's say it is what? It is going to be, let's say, this is 7. What does that tell you? Basically means you subtract, right? So pH 7 minus 5, what is that going to give you? That's going to give you like negative 2. That's what it's going to tell me, right? And what's the negative 2 tells you about? You have to work here. Look, negative 2 is like you're playing down here. Negative 2, and if it's a weak acid, you're playing down here. So this is basically you're dealing with like some kind of acidic drugs environment. All right? That's something really you have to remember this. And you know, one thing that I do have to talk about here is that, you know, sometimes if they were asked in your exam, right, then, you know, I think it's important to like know these equations that might help you to, you know, answer some of the questions if they give you a pK. Basically what you should do is like, and this is for, let's say, weak acid. All right? If it's for the weak acid. If it's a weak acid drug. Here's what you do is like, look, basically, if you want to find the percent, like ionizations, all right? This for percent ionizations or not ionizations. Basically for the weak acid, what you do is like, look, what you do is you have to figure out the pH. So basically, because we're taking of the log of that, log of something, right? So you do a pH. So you do right here, write down 10 here. And what is pH minus pKa over 1 plus, write down P 1 over 10 over pH minus pK. You should remember this equation. This might help you. So let's say my pH is, in this case, I'm dealing here, right? My pH is less than my pK. So if I'm dealing here, let's just say my pH is, let's just 7 here. And then my pK, let's say I'll just say 5 for our case, right? And then what is this? 1 plus, okay, so this is going to be 10 over pH minus pKu. 7 minus 5 would be 2. And then 1 plus 10 over 2. What does that give me? 7.5, so that's 10 to 100 over 101. Right? 101. So when you divide this, 100 over 101, what is that going to give you? 100, right? Divided by 101. Right? And then that will give you 99. Basically, then you multiply by 100. That gives you 99%. That means that, but your pH is greater right here. That means this is like the 99% is what? It's non-ionized. Sorry, it's ionized form. All right? Because the pH is greater. That means that we're talking about this right here. The 99% has been ionized. And if you subtract by 100 minus, let's say 99, right, that should be able to give me 1. So 1% will be my like non-ionized form. All right? But if I say that my pH should be lower down here, that means, that means I'll have some other numbers too. All right? And so this is how you can calculate the ionizations and non-ionizations. And oftentimes they do ask that exams. And this is for the weak acid. And if you want to figure out, let's say for the base, all you have to do is like, look guys, same thing, but all you have to do is like weak base right here, okay? And then just write down the equation here. You just do 10 here, but instead of writing pH minus pK, just write down pK minus pH. Over same thing, 1 plus 10, and then write down pKa minus pH. Just switch that, weak base, and then plug the number in. You'll know how to answer. So this way you can, if you practice it, you can do it very quickly also. Now this is how you can figure out the percent ionizations or percent non-ionizations. All right? And remember, as I said, what is the importance of this is that, based on the characteristics of the drugs, if it is a weak acid drugs, then weak acid drugs or acid drug, they work best on the acidic environment. All right? And let's say if it's a basic drugs like PCP or let's say amphetamines, they work best on the basic environment. And what is the importance of this is that, guys, let's say if you overdose on aspirin, right? If you overdose on aspirin, that means what? We want to clear the aspirin out of the system, right? So if you want to clear it out of the system, what do you want? What do you want? What kind of drugs do you want to give it to? Remember, if you want to clear the aspirin, let's say this is acidic, like you give aspirin, and that's acid, right? That means what is going to happen? You don't want to give drugs that's going to do what? That's going to create more acidic environment for the dog. Okay, because remember, if there's more acid environment is there, what's going to happen is that drugs will convert more, it will make more this what? Non-ionized, and it will keep what? It will keep becoming non-ionized compound, and then it will keep, going to the different parts of the cells. So we need to give a drug something that is what that's going to do is that is going to, cause or decrease this proton concentration. Let's say this decrease proton concentration, because if you decrease this proton concentration, this reaction, let's say this is an aspirin compound, this will start deprotonating or deassociating into what? In ionized compound. And ionized compound, what do? We can remove this. We can remove this from our system. So that's the reason why it is important to know the ionizations, because it can help us to to treat the toxicity people. All right. So the most important thing here is that whenever there is an overdose on the aspirin, all right, or let's say any acidic environment, acidic drug, you want to give a drug, that decreases its proton concentration right here. So that way this reaction is going to go this direction right here, and that going to disassociate into more in a liquid, in a water soluble form. Same thing here. if you overdose on, let's say, this base, right, on a, let's say in PCP or amphetamines, you want to give, okay, you want to give like drug that is acidic drug. You want to give more proton concentration drug, and that is going to drive the reaction to make what? More ionized form. So then this is an ionized form, right? And this ionized form is a better cleared, okay? So that's the reason why this graph is basically telling you, right? So the importance of knowing the ionizations, it's one is that where it's going to get better absorbed, and other thing also that to treat, like, you know, to treat patient, because sometimes, like, you know, if the people have like gastric problem or something, you don't want to give a drug that can go to the gastric or that can irritate the gastric. You might have to figure out some other way or some other route or some other way to give that drugs, okay? And that is determined by these ionizations. I know, guys, this is hard, but like, you know, I have to stress on this because this is a very, very important concept here, all right? That's the reason why I'm keep repeating about this, all right? And I want you guys to like talk about this even more and more because this is a very, very important concept here.